Good afternoon, buenas tardes. This is Dr. Renteria, Medical Director for the Tribe. Thank you for listening to us today. Today also we have Councilwoman Frias that's going to participate in today's Facebook. Two things I want to cover. The first one is that I wanted just to share some thoughts about the new COVID variant. It's called Omicron. It's coming out of South Africa because there's, I think, a lot of fear associated with it. And there was a lot of information this last weekend. So I want to share a little bit with you and just some bullet points. It is more contagious than the Delta variant. It is following the pattern like Delta, that's where the Delta was more contagious than the Alpha variant. With both Alpha and Delta, the percentage of cases leading to hospitalization or death actually held steady. So an important thing to understand is that viruses want to reproduce. They becoming more contagious allows them to do that. Early evidence right now, this is literally just in the last few days, suggests that Omicron will follow the same pattern as Alpha or Delta, that is being more contagious but not causing more severe illness. The most severe cases are still in those that are not vaccinated, and the World Health Organization will release more information on this new variant in a couple of weeks, and we'll share that with you. The other issue I wanted to address was that our biggest problem right now for the community, the tribal community, is those folks that are not vaccinated. Because especially with this new virus, it's more effective in getting to those that are not vaccinated. So in the last numbers we had this last week, we had 47 positive cases. Of those, 78% of those cases were in community members, and 80% of those community members that were positive were not vaccinated. So our risk pool is really those that are tribal members that are not vaccinated. So we're working on trying to get to the community more instead of having them come here. The health department is coming up with some ideas of how we're going to go out and reach to the different communities. But again, for those of you that are listening, you're not vaccinated, even if you're healthy and think nothing's going to happen to you, you really need to consider it, because there's more and more information that there will be some long-term effects of these viruses to your internal organs, primarily the heart, lung, liver, and kidney, and they may not show up for 5 to 10 years. So think about that down the road so that you don't end up with something that might cause problems for you later. So again, as soon as we know more about this virus, we'll share that with you. So I'm going to ask now Councilman Frias to share some thoughts with you.
Hello, Leo Sanchanavu. Again, my name is Herminia Frias, one of your tribal council members. I hope that everyone had a good Thanksgiving and a restful Thanksgiving. Our thoughts and our prayers, we continue to share our thoughts and prayers to all of you out there who have lost community members, family members to COVID-19 or for other reasons that you've lost loved ones, because we have continued to lose people in our families, in our communities that we care very much about. And right now during the holidays, it makes that even a little bit harder. So just during Thanksgiving, special prayers for those people in our lives that are no longer here, but that we keep them in our hearts. Always want to mention that. I do want to share that we continue to have our vaccine clinics, our pods here in New Pascua, and we have them in Guadalupe, and that we, as you know, we have expanded to the 5-year-old and to 11. So we want to encourage all of our community members to get vaccinated. I know that we all want to go back to normal, and a lot of people are going back to normal, and we are doing things a little bit different, like maybe not wearing our mask properly, or not using our hand sanitizer anymore, or maybe not using our, sanitizing as much as we used to, or even forgetting what the protocol is. So we're testing positive and things like that happen. So I want to encourage you to go to our website and look at the resources that we have to remind you of what to do when you do test positive, if you do test positive, because information is there. Or to call our nurses and ask them, what do I do for my family member if someone tests positive? Because we have information to help you. and go to our vaccine pods and get vaccinated. We have a clinic this Saturday here at Pascoyaki for 5 and 11-year-olds here at our clinic. We have one this Thursday at our health department. We have one in Guadalupe on Saturday at Frank's school. It's going to be a different side. It's down the road from our building. And then we're also having them in Guadalupe on the 17th at the Guadalupe building, and also on the 21st. And you can contact Ricky Vidal at 480-768-2066. Again, I want to emphasize how important it is for you to continue to get as much information that you can about COVID-19. I know it's been a lot of brain drain and people get tired, and we're all tired of it, but we can't become complacent because we have to continue to take care of ourselves, and we have to continue to take care of our community. And as long as we do that, we'll be around, and we look out for these little ones that are in the community, and we look out for our elders. So please do your best. Look out for your neighbors. Look out for anybody who you see that may look like they need a helping hand, and offer that hand for them, because we just don't know. So please, if you don't know, call our nursing department, call social services and ask. We'll be here and we will do our best to answer your questions, Dr. Renteria. And sometimes we just don't know until we ask, and sometimes it's not until we test positive that we realize we don't know what to do. So thank you for listening, and please get vaccinated and get boosted. We are offering the boosters to everyone who has already gotten their shot. So please get boosted here at Pascoyaki on Thursdays, or get tested. And for the 5 and 11-year-olds, please have them get vaccinated. Thank you.
I just want to add one more thing before we go. I believe we're right now in our community at the peak of the Delta variant. And what that variant has showed, that it is more aggressive with children. So this Saturday's vaccination pod, which will be at our new health department, please bring your children between 5 and 11. It's just really important because they're the ones that are pretty high risk right now. Also, if you're a non-tribal employee, we're starting to vaccinate children of non-tribal employees this Saturday also. So if you fall in that category, again, bring your little ones from 5 to 11. Thank you.